Does my kid have hand, foot, and mouth disease? That is a really good question. Hand, foot, and mouth disease is going around Tucson, Arizona right now. Usually it is highest spread in the summer and fall time. And well, we're going into winter, but I'm still hearing about some cases. So thought we'd talk about it today so that you can know whether or not that's what your kid has. Hi, I'm Dr. Kate Sage. I am a naturopathic physician and I practice family medicine and pediatrics in Tucson, Arizona. So hand, foot, and mouth is a virus and it is very easily spread. It's spread through respiratory droplets and also through feces and pretty much any snot, saliva, getting spread all over. You can pick it up really easily by sharing toys with other kids that have it, towels, you got it. So really prevention is not touching your face and then also washing your hands a lot. But as we know, kids are really good at touching their face and not as great at washing their hands all the time. So it goes through daycares like wildfire. So how do you know what it looks like? What happens is that babies get like little itchy spots on their hands and or their feet and or in their mouth. So you don't have to have all three, but sometimes you do. And I said babies, it's actually kids, usually 5 and under are the ones that most commonly get it, although you can get it at any age. Usually the disease is pretty mild. It might last 5 days. You're contagious for the whole week. But that said, the CDC does not even recommend that kids stay home. Although a lot of times I think they're not going to want to go to school and hang out because they're not feeling very good. And they can have a little bit of a fever. So if they are, a super snot face and not feeling good, I wouldn't send them to daycare because that's also another chance to spread it to everybody else. Some complications of hand, foot, and mouth disease include dehydration. And I notice in my practice that a lot of times kids don't want to eat, and that includes nursing. And so because their mouth hurts, they may not want to latch on, in which case you want to either use a syringe to get some food in them or popsicles if they're old enough, just to keep them from getting dehydrated and low blood sugar. In weird circumstances, you can also lose fingernails and toenails because you've got lesions on those. Worst case scenario, the virus goes deeper and causes issues in the brain, but that is super duper rare. So what's treatment? Really, it's just all of the things we normally do for the virus and then helping kids stay comfortable. And so we go back to our vitamin C and our zinc, vitamin D up to 1,000 or 2,000 depending on the size of your kid. Popsicles are a great way to help with their mouth. And so what you can do is you can actually make herbal popsicles to help with pain. And teas that work great for herbal popsicles include chamomile tea or lemon balm tea is very soothing because it's also good for pain. So if you can make lemon balm tea, add a little honey, and then freeze them in a popsicle shape, your kid will love you and also it'll help them feel better. Thanks so much for watching today. If you enjoyed this video, please don't forget to give me a hands up. And I would be honored if you'd subscribe to my channel.